How do we manage maladaptive behaviors in in-home support settings? This video explores effective strategies for understanding and addressing challenging behaviors in young adults with developmental disabilities. Learn how to transform these behaviors into meaningful communication. Maladaptive behaviors are actions that significantly interfere with a person's learning, health, or community participation. For young adults with developmental disabilities, these can include aggression, hitting, kicking, biting, self-injury, biting or hitting oneself, property destruction, breaking objects, tantrums, elopement, running away, or severe non-compliance. These behaviors are not willful bad acts, but often signs of an unmet need or stress. For example, a person might scream when upset, throw objects in frustration, or repeatedly engage in self-harm. Every challenging behavior is a form of communication. For instance, behaviors may signal wanting something, not wanting something, or needing attention. Understanding that behavior is communication helps staff remain calm and curious rather than punitive. In California, clients have the right to refuse painful or traumatic behavior interventions, and they must be treated with dignity and least restrictive supports. Always remember that individuals have rights to humane care and safety. Staff should never use procedures that violate those rights. Behaviors occur for reasons and in response to triggers. Functions typically include attention, escape, access to tangibles, or sensory needs. Triggers might be sudden changes or sensory overload. Understanding patterns helps prevent issues. Staff should ask what the person gains or avoids through their behavior. Behaviors happen for a reason and often in response to something. Typically, behavior functions fall into 4 categories: attention, escape avoidance, access to tangibles, or sensory automatic. For example, a person may act out to gain a caregiver's attention, to avoid a demand they find hard, to get a desired item or activity, or simply because it feels calming. To figure out the function, staff can ask, what is the person getting or avoiding by doing this? For instance, if yelling always makes people leave the room, the person may be escaping the task. If hitting gets a favorite toy, the function may be tangible. Preventing maladaptive behavior involves positive supports and planning. Structured environments and clear communication are key. Engage individuals with meaningful activities and manage triggers. Sensory supports can help maintain calmness. Regular observation and planning are essential for success. A clear, predictable daily schedule reduces anxiety. Visual schedules and timers help individuals know what to expect. Consistent routines prevent frustration. Warnings before transitions can ease stress. A structured environment supports emotional stability. Understanding communication. Use simple language and concrete words to ensure understanding. Gain the person's attention before speaking. Calmly use pictures or gestures if needed. Breaking tasks into small steps avoids confusion. Checking understanding prevents miscommunication. Engage individuals with activities matching their interests and abilities. Offer choices to give a sense of control. Praise and rewards encourage appropriate behavior. Reinforce skills like asking for help. Positive feedback strengthens replacement skills. Minimize known triggers by reducing noise and clutter. Consistency in environment helps prevent distress. Offer support for difficult tasks. Allow movement breaks for calming. Adjustments can prevent escalation. Some individuals need sensory input to stay calm. Provide stress balls or fidget toys as safe outlets. If overload is an issue, offer quiet spaces. Breaks can help manage sensory challenges. Sensory supports are crucial for emotional balance. When maladaptive behavior occurs, respond calmly. De-escalation and safety are priorities. Maintain a relaxed posture and give personal space. Use simple language and offer choices. Redirect to calming activities when needed. California law limits behavior management interventions. Restraints are only for dangerous situations. Clients have rights to dignity and choice. Least restrictive alternatives must be prioritized. Confidentiality and reporting are essential. Accurate documentation is vital after incidents. Use neutral language to describe behaviors. Record antecedents and consequences, include time, date, and context for clarity. Timely reports ensure accountability and guide interventions. Recognize the impact of trauma on behavior. Avoid re-traumatizing practices like force. Explain actions clearly and seek consent. A predictable environment fosters security. Respect and empathy are foundational. Clients have the right to make choices, even risky ones. Support independence with safety measures. Encourage learning from experiences. Overprotection can hinder growth. Dignity of risk is crucial for self-esteem. Ongoing learning improves staff skills. Training covers behavior support and client rights. Crisis intervention skills are essential. Peer learning enhances understanding. Competence in managing behaviors is crucial. Managing maladaptive behaviors requires understanding and empathy. Through proactive and reactive strategies, staff can support positive change. Emphasizing communication and rights ensures respectful care.